Hello and welcome to your restorative yin and MFR session. We're going to try to hit the entire body, even though I know we're kind of short on time. So we're actually going to start from the top of the body and work our way down and finish with the feet. You are going to want a few props for today. You're going to want some MFR balls. And again, if you don't have those, tennis or lacrosse balls will work just fine. A set of yoga blocks. And eventually it's going to be nice for some supported twists for our back health to have a bolster and a blanket. So make sure you have everything that you're going to want, and we can go ahead and begin. So for our first bit, we're going to focus on the upper back and the neck. So you're going to want one of your blocks and your two MFR balls. We're going to place the MFR balls right along the traps to the back. So right along the spine, making sure we're not pushing into the spine or anything like that, but placing them just kind of right where the traps and the rhomboids connect in the upper back region. And if it helps you to visualize it, think your collarbone going straight through the collarbone out the back. That's where you want to place them. So go ahead and slowly start to transition onto your back. And keep your block just within arm's length. So make sure it's not too far away. So go ahead and take one of your MFR balls in your right hand and then place it underneath the left side. And then take the other ball in the left hand, roll a little bit onto that side to do the same. So then they should be right along the meaty part of the traps where we tend to hold a lot of tension in our neck. And again, they're just framing the spine. They're not actually on the spine. And then maybe this is enough, especially if the neck is really, really tight. We just want to stay here. But it can be nice to also take a block on its very lowest setting and glide it right underneath your tailbone and sacrum. And that helps just give us a little bit more body weight to push into the props to help release a little bit more tension. Now, depending on how your body feels today, it might be the most nourishing and rehydrating just to stay in stillness and to allow the compression to release all of the tension in the body. But if you want a little bit of movement, it can be nice just to very, very gently reach the arms overhead and then slowly lower them back down by your side. And if you're adding movement, or even if you're staying still, slowly start to find a breath that supports you. Really focusing on softening and surrendering into the props so we can really release the tension through the neck and through the shoulders. And use your breath to slowly start to tap into calming down a bit. Starting to find that little bit more of relaxation. And if you were moving the arms, go ahead and slowly come back into a stillness. Take a couple more breaths here. And then slowly press through your feet to lift yourself off if you used a block and remove that block. And then one vertebra at a time, lower yourself back towards the floor. And you can either reach back and remove the balls completely, or you can just start to roll up to have a seat and come off the balls and leave them where they are. We're going to stay in this region with some gentle stretches and then moving into some nerve flossing, which can be really nice to get the blood flowing back in, especially if we have any kind of nerve issues or pain in the neck and in the shoulders. So at first, we're just going to start with a gentle stretch. So sitting upright, and maybe you want to move towards the wall so you can feel supported in your spine and not have to hold yourself up. So you choose if you want to move towards the wall or just stay in the center of your room. But we're gently just going to let the left ear fall to the left shoulder. And maybe that's enough of a sensation running down that right side of the neck. Or if you want a little more, just gently reach your right hand out lateral to your right hip. And then again, as you start to settle in, then start to focus on your breathing. Feeling that release, a gentle tugging sensation in the right side of the neck, all the way from the upper neck and then where it connects into the shoulder. And take one more breath here. And then bring your head back upright. Now, as we move into nerve flossing, I just want to let you know that we're not looking for a lot of sensation here. We're really just trying to open up any kind of compression that might exist on the nerve to allow the blood to flow. So we're going to stay on the right side. Go ahead and reach your right arm out. So as you flex your right hand and the fingertips come towards the back of the arm, let your right ear come to your shoulder. So we're putting tension on the nerve at the end where it connects with the wrist and giving it some slack where it connects with the neck. Then we're going to rotate the fingers so now they're coming forward, so like the back of the palm is towards that wall. And then we're going to take our ear to the other side. So now we're putting slack at the wrist and tension at the neck. We'll go through that a couple times slowly. So let the ear come to the other shoulder, flex the hand. And then as you change the wrist, ear comes to the other side. And the other thing is you just kind of want to tick-tock the head laterally side to side. Make sure you're not moving the neck in any other way. And then once you kind of get used to the rhythm, start to flow it to your breath. Putting slack on one end of the nerve as you put a little bit of tension on the other. And again, we're not going for a lot of sensation here. We're not wanting to stress or stretch out the nerves. We're just wanting to floss or help them glide through the muscle to stimulate better blood flow and release some pain we might have in the neck and shoulder. And take one or two more here. And then slowly release that back in. And we're just going to do the same thing on the other side. So we're going to start with the muscle stretch through the neck. So let your right ear fall to your right shoulder. Now moving into the left side of the body. And maybe this is enough today, especially if we feel really tight. We really want to allow this to be more nourishing rather than intense. We're not always looking for the most intense stretch. We're looking for what can really support and nourish our bodies. So if you need a little bit more, go ahead and reach your left hand down towards the floor and walk it out just a little bit until you can feel that nice stretch through the neck. But again, over tugging sometimes can do more damage than good. So just honor how it feels in your body. And then as you start to settle into the stretch, again, come back to your breath. And take a moment to just really reflect on how it feels. A lot of our pain is in our perception. So being really able to tune in with ourselves and how we feel can affect ourselves and how we perceive that threat of pain. So then lift the head back up, release the hand, and let's move into that nerve flossing. So extend your left hand out. Now, as you draw the fingers back, let your left ear come to your left shoulder. And as you draw the fingers forward, take your head to the right. Fingers back, ear to left shoulder, fingers forward, and release. So really just start to notice that slack on one end of the nerve with tension on the other, and then that shift. So we have this nerve that connects from our shoulder all the way into the hand. And so we're trying to just gently allow that to glide through the muscles, through the bones, all along the way, without putting any extra tension or sensation into it. And take maybe just a couple more. And then slowly release it back in. Before we move down towards the cervical spine, we're going to just do a nice little nerve flossing motion for the nerve that comes from the outside edge of your pinky up into the shoulder. Now, you've probably done this as a kid. You make these little eyeglass things on your face. That's exactly what we're looking for here. So we don't really need the thumb and the index finger, but what we're wanting to do is take the pinky ring and middle finger and kind of support the head. But I think it just helps if we come to this little shape just to really find that stimulation. Now you should feel a nice little tugging, nothing too sharp or painful, through the pinky and then down through that arm, and where it's going to cross connect to the elbow and up into the shoulder. And it might radiate mostly through the pinky. That might be where we feel that flexion through the pinky and through the wrist. Just take a couple of breaths here. And if you did decide to just do one hand, just supporting, just make sure you do both. Take just another breath here. And this can be really, really nice if we have any kind of wrist pain or issues. Again, we're not looking for a huge sensation. We're just really looking for that rehydrating of the nerve, allowing it to just kind of floss and glide. And then release and let that go. So we're going to move into the cervical spine or the upper back. So you can use a block if you like for the back of the head. I like a blanket. I just find it the softness a little bit more tolerable, more comfortable. But we're going to want our MFR balls. And what we're looking for here is the scapular region. So you have these two big bones back here in your scapular region and in the muscles. We're going to want to come again just outside of the spine and in the mid scapular region. So this one can be a little precarious to get into. So you kind of have to just muscle it up at first. Now go ahead and roll onto one side, place a ball right in the middle of that scapular region on the outside of the spine. And then for just a second, you kind of got to roll and then try to match the other ball right next to it. Again, just framing the spine. And then you'll want your blanket to support the back of the head. And what the sensation should feel like is kind of a chest opening. You've got the balls right behind the chest region, right into the lower part of the cervical spine and where it connects with the thoracic. So think lower upper back before it starts to turn into the mid back. And again, we can stay here and just let the compression help to release any issues we might have in the fascia. Or we can start to give ourselves a little hug and then release and then switch which arms on top. So if you're craving movement, make it really gentle and restorative and nourishing. But sometimes it can be nice just to stay still. And notice if you feel any sharp or hot spots of pain, your MFR balls might just be in a spot that's not good in your body. So just little microscopic movements up or down, just to find that spot where it feels a little bit of sensation, but nothing too overwhelming. Nothing that you shouldn't be able to stay with your breath through. And again, come back to that introspective awareness, how it feels. Rewiring how our nervous system communicates with the brain and with the body. Your pain receptors and neurons actually die every few days. So there is the potential to relay how we perceive pain. And that's through mindfulness and trying to communicate well with our body. So that's a much deeper subject we can talk about later. Take another deep breath in. And then slowly release. Before we come into some nerve flossing, we're just going to do a little bit of a deeper stretch. So for this one, go ahead and grab your 2 yoga blocks. And we're going to do a supported fish pose. So placing one on its middle setting, underneath where your shoulder blades would be. And again, we don't want to go too intense here. So we're going to allow the block behind it for the back of the head to be on its higher setting, which will just give us some extra support. So as you start to come down, you're going to want this first block to catch the bottom of that scapula, which we were just working, and support the entire shoulder blade region. So if you feel any sharp pinching sensations, you might be in the rib, and we want to avoid the rib cage. And then the block behind us is just going to catch the back of the head, and we can just let our arms rest down by our sides. Now, depending on how you feel, it might be nice to grab opposite forearms, wrists, or elbows and let the arms be overhead. But if that feels like too much sensation, again, just bring the arms down by your side. And again, sometimes in these quiet moments, it's when the mind starts to wander about and to focus onto other things. But use this opportunity in the quiet to really look inward, to see how things feel. And that could be mentally or physically. Maybe you start to notice a shift and you feel something you didn't know was there before, a little pinch or twinge somewhere in the body that we need to honor and take care of. And take just one more breath here. And then slowly release and peel yourself off of your props. We'll go ahead and set them off to the side. And we're going to transition into tabletop. And once we get there, think cat-cow for your spinal flexion and extension. But we're just going to do, again, a little nerve flossing. So we're going to flip the orientation of the head. So normally, as you would let your belly drop, you would take your gaze forward. But today, as we let the belly drop, we're going to actually tuck the chin into the chest. So when you're in your cow pose, the chin will be tucked. So we're putting pressure on the spine, the spinal nerves, and giving it slack where it connects with the upper. Then as we round the spine like we're coming into cat, we're going to gaze forward. So again, as we put that pressure on the cervical spine, we're releasing it at the top. So one side has slack, one side has tension. So come through your cow pose, tuck your chin. And this will feel really, really, really counterintuitive. And then round your spine and look forward. So what your body is used to doing, we're wanting to do the opposite. Cow pose and tuck your chin. Cat pose and look forward. And then keep that going. Once you find a rhythm, it'll be easier to keep it. At first, you're going to have to be a little awkward. And feel the sensations along the spine and the back and how that releases a lot of issues or pain or whatever it might be that we're dealing with. And take just a couple more rounds here of this nerve flossing cat-cow. And just make sure you're breathing. And then slowly come back through neutral and come back to having a seat. So we're going to go through the lumbar spine and the hips and the glutes and the front hips. All on our back. So just make sure you've got some blocks that are within arm's reach, but you're also going to want your MFR ball. So we're going to want to find the spacing between the bottom of the lumbar spine and before it turns into the sacrum and the end of the thoracic spine. So you've got this little region of low back, It's where your natural curve is. So you'll feel, if you want to feel for it, you'll feel your rib cage end. And that's where we're going to want to put the balls, on the lateral side of the body underneath our rib cage. So not on the rib cage, but under it. So to get into this, we can come onto our backs and we can bridge our hips up and then find the end of the rib cage and then place the balls on the outside edges. So you might be able to see, maybe not here, but you see the ball is kind of more towards the outside of the body instead of next to the spine like we have been. And then for here, for more sensation, we're going to focus on the tilting of the pelvis. So as you tilt your pelvis up, you'll feel the grounding into the balls for compression. And then as you tilt your pelvis down, you'll feel a little less body weight and release through the lumbar spine. So tilt your pelvis and compress, and then release. And now the next time you tilt the pelvis up and you feel the compression, stay there and just gently start to windshield wiper your knees side to side. And you'll feel that gentle massage through the lateral lumbar spine. And if we have any kind of hip or low back issues, this can be really restorative and nourishing. And again, when we're in these quiet moments, try to keep noticing the sensations in the body or stay focused on the breath. Really starting to tap into that more mindfulness. And then start to gently slow the windshield wipering of the legs down. Release the tilting of the pelvis. Go ahead and lift your hips up one more time. Grab the balls. We're going to place them in more towards the spine and kind of at the top of the tailbone, top of the sacrum area. So they're right along the spine at the lower edge of the lumbar. And then maybe we stay there with the feet on the floor, or maybe it feels good to start to bring our knees into our chest. And again, knees to chest is just going to provide a little bit more body weight for some compression. But if it does not feel good or nourishing, just bring the feet right back to the floor. And if feet on the floor is still a little too intense, start to straighten your legs out onto the floor. And again, focus on that breath and use that to tap into your restfulness. And then if you did hug the knees into the chest, release one foot at a time back to the floor. If you straightened out the legs, go ahead and bring them back in. And then we're going to lift the hips one more time. We're going to place the balls right in the center of the meaty part of our glutes. And after a week of squats and deadlifts, this might feel a little intense. But gently just start to windshield wiper the knees once you have the balls right in the center of the glutes. And maybe movement today doesn't feel good and it's too intense. So maybe you just stay still and allow the compression to take place. And then if you were moving, slowly start to come back to stillness. And try to soften your body as much as you can. So rather than holding and supporting yourself, Let yourself just melt around the balls. And then slowly press through the feet to lift your hips off and set the balls off to the side. Now we're going to go into a figure 4 shape for a supine pigeon. But if you prefer prone pigeon with the knee next to the wrist and you want to flip it over onto the belly, feel free to take a more traditional pigeon pose. But we're going to place the left ankle on top of the right knee and then reach through and hug the right knee into the chest. Now, ever so gently start to rock side to side. Just thinking, moving and gliding along the sacrum and the tailbone. And then think, hugging your right knee into the chest as the left knee is trying to pull away from the chest. And then when you're ready, slowly start to stop the rock and just stay in stillness. And you should feel a nice big release to the outside of the hip. But if you need a little more, you can take your left hand to the inside of your left knee and gently push that knee away, trying to get your left knee in the same line as your right knee, so you can really feel that release throughout the outside of the hip. And take another deep breath here. And then slowly release the grip on that right leg and then release your left ankle from your right. Place your right ankle on top of your left thigh. Reach through and hug that knee into the chest. And again, try to actively pull the left knee in, push the right knee away. And then maybe if it feels good, you find the gentlest of rocks side to side. Or maybe you just hang out in stillness. And if you were gently rocking side to side, slowing it down until you can find stillness. And take one more breath in. And then slowly release down. Go ahead and stay on your back. We're going to move into the front of the hips, the iliopsoas muscle. And so go ahead and grab one of your blocks. Or if you want to go a little deeper, you can use 2 blocks. Just make sure they're stacked on their lowest setting so it's the most stable side of the blocks. And one final time, go and bridge your hips up and slide that block right underneath your tailbone sacrum. Hug your right knee into your chest. And then extend your left leg out long. And you should feel a nice stretch through the front of that left hip. And then on the next breath, just bring your left knee into the chest and extend your right leg out long and let that leg rest on the floor. And then keep your left knee into the chest. Bring your right knee into meet it. Loosely hug the knees in. We're going to give the low back a little bit of love as we place the hands on the kneecaps and we just move the knees in a circle. Really releasing that lumbar spine and where it connects with the hips, which can be really problematic for a lot of us. And then just gently change the direction of your circle. And then slowly release, bringing your feet to the floor, firmly pressing through to release your hips and coming down one vertebra at a time. Rolling up to a seated posture, however feels good. Maybe if we're really embracing the back, we might just gently rock and roll along the spine a couple times. But maybe that's too energized and active and we just roll onto one side. But if you do decide to roll along the spine, just make it really nourishing, really calming, really restorative, just to give it a little massage. We're going to move into the hamstrings now. So we're going to place the MFR balls right beneath our sit bone. So if you feel in the meaty part of your glute, you're going to feel this valley where it drops off, and that is where your sit bone ends. So we're going to place the ball right there. And you're going to want to do it on both legs. And as you start to let that sit in, go ahead and take the hands behind you and straighten out the legs as much as you can. Now, this might be enough sensation where we might want to start to fold forward. Now, we might not find a whole lot of range of motion folding forward here, but it should be releasing right where the leg starts to connect with the hip. And try to soften the upper body as much as you can. And then just glide the balls down a little bit. So now they're more, and maybe you have to pick up and move them. So they're more in the middle of the hamstring. Imagine if you could draw a line straight through the quadricep. And then fold over as much as feels safe and comfortable to do so. And take another breath here. And then maybe we just start to point and flex the feet, gliding just that little spot through the hamstring along the balls. And then go ahead and release. And one final spot, just an inch or two above the knee. So like here's my knee, I'm just an inch or two above it, not crazy. And then fold again over the leg. And again, if you feel a sharp or hot pain, the balls might not just be in a good spot for your fascia. So just move them just either to the side a little bit or forward or back a little bit. And slowly lift up and release. And then we're going to use our two blocks for some calf fascia shearing. So we're going to place them on their low setting side by side, kind of like you're just trying to make a big rectangle. And you're going to place the meaty part of your calves right on the center of the blocks. And then think with your big toes, just trying to draw little infinity symbols or figure eights. And you're not moving the legs per se, but the origin of the movement is from the toes, and the leg just kind of has to naturally follow. So we're just rehydrating and stimulating this fascia through the shearing technique. And it should just feel like your skin is gliding on the blocks. Take just a couple more. And then slowly release. Go ahead and set your blocks off to the side. And grab just one of your MFR balls. And we're going to place it just to the outside of the knee. So my knee is on the floor. I'm in this lower corner. So I just want to show you where we're at, but then I'm going to rotate around so you can see what we're doing here. So we're going to place it in that lower corner of that quadricep and then frog out your other leg. So you've got that ball compressing through the bottom corner of the quadricep of one leg, and your other leg is bent, just giving you some support. And this might be really intense if the fascia is really, really tight and rigid in the front of the thigh. So just stay with the compression and focus on your breath. And then reach down, grab the ball, move it up just a couple inches, but stay on the lateral side of the quadriceps, so that outside ridge. And maybe this time we can flex the foot to lift the leg and find a little rolling motion. But again, if that's intense, just feel free to back off and just stay in the stillness for compression. And then lower the knee, reach down. Go ahead and release your frog leg, and we're going to switch sides. So opposite leg, find just that little corner, and then extend your other leg out to the side to give you some support, and just stay in the stillness, compressing that lower corner of the quadricep above the knee. And then reach down, move it up just a couple inches. And maybe you stay in the compression, or maybe you pick up the knee by tucking the toe under, and you roll along that outer ridge of the quadricep. And slowly release. And you can set your myofascial release balls off to the side. And we're going to finish with a very gentle spinal twist to re-nourish the spine, specifically the thoracic and where it connects with the lumbar. So for this one, you're going to want your bolster or a firm pillow or a couch cushion. And if you don't have that, maybe 4 stacked blanket. But if you've got a bolster, we're going to use a bolster and 1 blanket folded into this little rectangle shape to give ourselves a lot of support. So this can be more restorative and nourishing rather than stimulating. So go ahead, and when you lay down, you're going to want a little bit of space between your hip and your bolster. I like to just place my top leg in the arch of my bottom foot, but you can lay however is comfortable. Go ahead and start to walk your hands out, and then think pulling your chest forward. So we're going to drape ourselves over it. So find the length first, and then slowly lower yourself down, looking the same direction as the twist. So not behind us, but forward. Let the lower half of the body surrender. And then once you're supported, let your arms find a spot where you're not pushing into them. And then we're going to stay here for about 2 minutes. So really focusing on decompressing the spine, and things like wringing out a washcloth is what the twist is doing here. It's rehydrating the spinal disc, and it's helping the blood flow throughout this entire unit, stimulating good spinal health. So really try to soften into the shape and let the props support you. Remember, when it comes to these types of training, often less is more. We're not looking for huge stimulation here, but a gentle release. And then find a way to bring the hands in to press yourself up. And all you have to do is unravel to the other side. I'm going to flip my props around so I don't have my back to you. But you feel free to turn your back around and just flip on over. We'll have that same setup, a little bit of space between the hip and the bolster. Walk the hands forward, think pulling and lengthening first, and then draping the rib cage, the chest, and eventually the head and the neck onto our props. And then again, finding a placement for the arms where we're not pushing into them. And sometimes being in absolute quiet can be a little intimidating. But I'm encouraging this introspective awareness, this checking in with yourself. You can use this as a tool to almost like journaling or self-care, to see how you're feeling mentally and physically, and to really just take some time to be with yourself. And take in another breath here. And then bring your arms in a way that can press you up. And if you have time for Shavasana, I encourage you to take a couple moments to just lay either prone or on your back just to finish and close off your practice. This video will end, and so you don't have to do anything. But thank you so much for joining me today for your MFR and your nerve flossing. I hope your body feels restored, nourished, rehydrated, and just overall better. Until next time, be well.